any of those numbers on the periodic table. The big thing is you just need to know how to use them. So if you look at Hg, which is mercury, how do you know how many protons that it has? It is the number on the top. Okay, so if you're looking at the periodic table, it's the atomic number tells you, so you just have to find Hg, which is mercury, so you know that it has 80. So there's 80 protons, and that means also 80 electrons. Remember, positives and negatives are equal, so plus and minus protons and electrons are equal when you look at that atomic number. So then figuring out numbers of neutrons, what do you have to do? Just subtract. So take the big number, subtract the small number. Take the big number, if it has a decimal, round it to a whole number. So it's 200.6, so just round that to 201. So I would round it up to 201, and then just subtract 80. So that would be 121. Okay, everybody got that? Zinc, Zn, you got to find zinc on the periodic table. Zinc has how many protons? 30, which means it also has 30 electrons. So remember, positive and negative equal. So now to figure out the neutron number, I've got to take 65.39 and do what? Round up or down? It's going to round down, so it'd be 65 minus 30, so 35 neutrons. Okay? So hopefully that one's like, okay, I think I got that, because I'm telling you there's a couple of these. Okay? You're going to have to do this. And so it's pretty simple. The biggest thing people get wrong is that they mix them up. Is they like look at the atomic number and tell me that's the number of neutrons and protons. And I'm like, oh no. Okay, so you just want to make sure that you get it straight how to use the periodic table to figure out protons, neutrons, and electrons. But now another way you might see an element written is with its mass number. So if you see iodine 131, iodine 131, what is that 131 telling you? It's the mass, okay? So if you then, that means that you need to find iodine on the periodic table. Iodine has what as its atomic number? So it is 53. So 53 is the number of protons. So protons, it's got 53. But that means it also has 53 electrons, right? Because protons and electrons are the same. Now, how do you figure out the number of neutrons from this? So you're not going to use the mass on the periodic table because this is talking about a certain isotope of iodine that has a mass of 131. So I have to take 131 and subtract 53 to figure out the numbers of neutrons. So 131 minus 53, so that ends up being 78. Okay, so if you're given the name with its mass number, use that as the mass. Don't worry about the mass on the periodic table, because I know sometimes, and if you look at iodine here, see that iodine's atomic mass is only 126.9. You would round that to 127. So iodine 131 clearly has more neutrons than normal. It's an isotope of your typical iodine, but it's got more, so make sure that you figure out numbers of neutrons from that mass number. Same thing with this next one. So, Au, first off, what is that? Gold. So Au is gold. You've got to find Au on the periodic table. You really don't if I give you the symbolic notation because it tells you everything you need to know. So how many protons does this have? 79, right? The smaller number. So remember symbolic notation, those numbers are flipped compared to how you see them on the periodic table, so don't let that throw you either. So I know 79 protons, 79 electrons, that's no different, that's the atomic number. Then how do I figure out numbers of neutrons? Yep, so you just take the 200 minus 79, so that would be 121. So notice that that 200, that is actually different than the atomic mass it's listed for gold on the periodic table. That is because this would be like an isotope, okay? So this is telling you specifically the number of neutrons on for that specific isotope of gold. So you don't have to worry about using the mass for the periodic table. If you're given either of these bottom ones, just make sure you use that mass that's listed. But if I just gave you mercury Hg and asked you to tell me, then you would use the periodic table. Okay? All right. So I wanted to make sure that everybody was pretty comfortable with those. So we've talked about all of these. We talked about alpha, beta, and gamma decay. So this was kind of like a good example. I'm not going to ask you to complete a reaction, but if I show you a reaction like this, so if I have this reaction, you should be able to tell me that that's alpha decay. And remember the big thing I told you to look for with alpha? Alpha decay is always going to have that helium as a product. So in alpha decay, a helium nucleus, which is 2 protons and 2 neutrons, they get shot out of the nucleus because unstable atoms typically have too many protons and neutrons in their nucleus. So this is kind of a fast way. Just shoot these particles straight out of the nucleus. So it goes down by a mass of 4, atomic number changes by 2. You're not going to have to like complete the reaction, but just recognizing, seeing that helium with a 4 and a 2, you know that that's alpha decay. Okay, so you won't see any others that way. So that's one of the products. With the second one, looking at this one, this is what happens when a neutron splits into a proton and an electron. Well, the neutron, when it splits into a proton, the proton stays in the nucleus, and so only the electron comes out, which is why then that electron is one of the products. And so in this, notice the mass doesn't change, so it's still 42, 42, but the atomic number increases by 1 because a neutron converts to a proton. So that adds to that atomic number, and it helps to make the protons and neutron numbers closer to equal. So it's going to help make it more stable. So if you see this, that electron being one of the products, that is a sign that that is beta decay. Okay, so seeing the electron as a product is a symbol for beta decay. So sort of like an easy way to pick it out, different from alpha. And then the last one. So the last one that we talked about was with gamma decay. And so with that, there's no particle, there's no change in atomic mass, no change in atomic number, no change in symbol. So notice that that iodine 125 on the left is still iodine 125 on the right. You might notice this funny little asterisk is really just their way of noting that this has more energy than the product. So that little asterisk is sort of like energized iodine. And then on the product side, that asterisk is not there because it has lost this. So that little gamma symbol represents the energy that is released when this atom of iodine has shifting and rearrangements in the nucleus of those very large number of neutrons. Because 125, if it has 53 protons, then that's like, what, 70, 72 neutrons? That's a lot of neutrons, okay? So when they have lots of neutrons like that, that tends to make that atom less stable, and so that's where iodine 125 undergoes gamma decay. So seeing this symbol, or noting that the reactant in the product, it doesn't change, okay? That the same symbol on both sides, it's the same thing, it's just showing this energy that's released. So those are really the only 3. So if I show you a reaction and ask you what kind of decay, those are the only 3 that you have to worry about. And really, they're pretty different, okay? Just the tricks for remembering each one. Then we were talking about X-rays. So I said X-rays are a lot like a gamma ray. X-rays can pass through soft tissues. X-rays are themselves not radioactive, but they are energy. They are energy that is generated when electricity, electrons, like bombard a metal. That metal gets stimulated and releases this energy like as a radiation form, and that is what an X-ray is. That can pass through soft tissues, but remember it's blocked by bone and teeth. So this is why you can see like a cavity in a tooth. So an interesting one, this is me, okay? So I had a knee replacement this summer. So that knee replacement, so see how white that is? So that's super white, that's metal, okay? So that's titanium. So what they end up doing is they basically hollow out the whole top of the end of the femur and the top of the tibia, and they put those titanium pieces of metal in, and then there's little plastic pads. And so you can kind of see, so that one right there, that little ledge, that's a piece of plastic, and that's what holds that whole joint together. So it links the two of them. Just so that you see, look at what my other knee looks like. So that is not supposed to happen. You shouldn't actually have things touching. Things should actually, there should be like blank space between, showing like the joint. But it's pretty amazing to me just how straight my right leg is now. Like walking, my leg's so stinking straight. And the left one is just all out of whack. It's like much more obvious just how bad off it actually is. But yeah, doing okay though. Just have to have that one done in December. Yay. Huh? Yeah. So on that side, so there's no cartilage. It's just both of my knees looked like that. But now the one is like it doesn't hurt anymore. It's just weird because it's not my knee. Like it's like something in there that's not mine. So getting used to that is the weird part. But the amazing part is it doesn't actually hurt. Compared to the other one. Like the other one's like creaks and it sounds like a ratchet when I'm walking, like half of the time. And they're both were that way, but they're better. But you can really see like defined outline of the bone. X-rays don't pass through the bone, so that gives you that outline. But all the soft tissue, so all of the muscle, skin, connective tissue, the X-ray can pass through. So it gives you this nice outline of the bone to be able to see it without having to do surgery. So that's really where X-rays just became like, oh, this is great, that we can see things internally, that we don't have to actually surgically open you up to be able to actually visualize things. So that was a really big boom that occurred. So why do you care is really the big question with radiation. So yes, it's important to talk about protons, neutrons, and electrons and get that down because we're going to use that in the next chapter talking about bonding. But the important thing about this radiation and nuclear chemistry is the fact that this energy that is released by atoms that are unstable is what they call ionizing radiation. Ionizing radiation has the ability to cause changes to molecules, which then can lead to changes in cells. That can change how cells function. That can cause cells to die. And that can also affect the controls over what they call the cell cycle. So most of your body cells, there are controls that determine how often those cells reproduce. So some, like your skin cells, are constantly reproducing. About once a month, your entire surface, the epidermis, is completely regenerated. So it takes about a month. So all those cells like rub off, but the underlying cells are constantly producing. But then you have things like brain cells. Once those are in place, they don't grow back. They don't get replaced. There's a few of them that do, but most of them do not. So there's a lot of variation in that control. And one of the challenges is that exposure to this ionizing radiation can cause damage to a cell. So you can have cell death. You can have change in cell function. And that could lead to a disease because this cell's not doing what it used to do. And now your body can't do what it's supposed to do. And now you start having physical symptoms because of this ionizing radiation. But it can also have changes in terms of cell growth. Uncontrolled cell growth is a characteristic of cancer cells. So this is why in all of for like 99% of you, you're either going into vet tech or you're going into dental hygiene or you're going into nursing. And so in all three of those fields, you are going to be exposed to ionizing radiation. You are going to have higher than what somebody that maybe like works at Belk's or works at the bank, okay? So you are going to have a higher exposure to this ionizing radiation as part of your career. So this is this understanding that this energy can cause damage. This energy can end up affecting you. We're trying to use it as a beneficial thing to be able to use it as an X-ray or to be able to use it for radiation treatment with cancer patients. But at the same time, you need to protect yourself so that you're not one of the numbers that is affected by it. So this is this understanding of blocking and shielding from forms of energy. So not all radioactive decay is the same. Alpha, beta, and gamma actually have different levels of energy. The lowest is alpha. So alpha decay, this is by far the weakest. In terms of distance, so if you have like a sample that's releasing alpha radiation, it's only going to go a couple of inches. So if you have your sample, you would be concerned about things that are like right next to it. So if it was on the table, not such a concern. Okay, not a big concern for you, even you, because it really would be just something like right around that. So it only is going to go a couple of inches. Beta, on the other hand, can go a couple of feet. So if you have a sample of an unstable element that is releasing beta, that you could think kind of like a yard. Okay, 2 to 3 feet is about the distance that you would want to be sure that you had shielding. Gamma is more like a football field. Okay, so gamma has the highest amount of energy and it travels the most distance. And we really don't talk about neutrons. Okay, these are the ones that we use as our example. So alpha, big particle, doesn't go very far. Alpha is the easiest to block. You could take a piece of paper, put it on top of an alpha emitting substance, and that would be enough to block it. It doesn't have the strength to actually get through a piece of paper. So it's pretty easy. Usually what they would do is you would like either wrap it in saran wrap, or they might just use regular aluminum foil, something that would cover and enclose it, and that would be enough of a shield that you wouldn't be concerned about ionizing radiation exposure.
Is that kind of like a microwave? It's a silly question. Is it like a microwave almost? Or is that just a
No, it's this. So you've got an unstable element that is shooting these helium nuclei out. Big particles just don't go very far.
Okay.
And so that's why if you have this substance, it's really only the space directly around that substance that would be affected by that ionizing radiation. It just doesn't travel as far because it's relatively large particles. So you could block this just with paper. Beta, on the other hand, you're going to need more because it has higher energy. It is able to pass further. It can pass into cell layers. It doesn't pass all the way through. But since it can travel about a yard, you would want to block its effects by either like heavy duty aluminum foil or plexiglass. Plexiglass is really like they actually make little plexiglass boxes. And so if a radioactive substance is kept in a lab, it gets stored in this plexiglass box. It's the ones that release beta decay types of radiation. And so that would keep it from being able to have a negative effect on you or creating this ionizing damage to any of your body cells. So plexiglass. And so does everybody know what plexiglass is? So you know, like at the hockey games, they have like the shields that they put around the rink. It's almost a half an inch thick. So it's enough to like block like a 100-mile-per-hour hockey puck can't go through it. So that's the type of stuff that they use. So it's like a really thick plastic, and they can actually like make, like we used to use this. I used to use this when I was in college. And so we had like a plexiglass shield and you would stand behind it. And so you would do things, or if you had to take your sample out, you would use it, but you would just kept that plexiglass shield between you and that sample, because that way the majority of your body is not going to be affected by that. In some of these cases, you can use like really heavy duty aluminum foil. You know that aluminum foil that's really thick? Okay. So most people like put it on their grills or something like that. So that can be an option as well, but it needs to be that thicker type. Gamma, on the other hand, because of this very high energy, gamma and X-rays, they're going to require lead, a half an inch of lead in order to create a barrier to block that energy, or concrete. So if they're going to build a medical office where they have an X-ray machine in use, then the walls of the X-ray room end up being built with concrete. So they'll use cinder blocks and put that in, and that way people that are outside of the room don't have to worry about any of that high ionizing radiation ending up being transferred to other parts of the medical office. Even the door, if you ever have the opportunity, if you go into like and where the X-rays are, the door, if you go to swing the door, super heavy. Why? Because most of the time they're lined with lead. So they actually line the door with lead, so it's not just a wooden door. So all of that is to try and make sure that you have this extra protection for other people that might be outside. So X-rays are the ones that you're most commonly exposed to. So notice that those can travel several meters. X-rays penetrate tissues, doesn't penetrate bone, so that means that it has the ability to go all the way through. So as an X-ray tech, or if you have to hold an animal, that's typically, you can't be like, okay, dog, lay down, and I'm going to go out here and take your X-ray, okay? Because with a dog down, walk away, dog jumps up, runs away, okay? So you end up inevitably, in vet tech, you end up having to be in the room. So what do you use? Yes, okay, that is a lead shield. Okay, so a vet tech is actually going to wear a shield. The lead lining on it actually goes up over your shoulders. And how far does it go down? Yeah, it goes like all the way down to your knees. So literally this whole front is covered. What they now know is that there is an area in your neck that is actually also very susceptible to potential damage. They found people that were working in areas where they were exposed to X-ray energy for a lot of their career. They had a higher incidence of what? What's here? Your thyroid. They had an increased incidence of hyperactive thyroid, overactive thyroid, thyroid cancer. And so it was kind of traced back because they look at like jobs and they look at like what kind of like risk factors. So now those little lead shields you wear, most of them have like a stand-up collar. So the front of it kind of like sticks up 2 inches. That's actually to protect your thyroid. If not, they even have a collar. So if they have like the old school, which looks more like a little apron, they actually have like a little collar that you just wrap around your neck when you're in there helping a patient, holding a patient. Because you've got to think, like, if you have a patient that maybe has dementia that has to have an X-ray, it's going to have somebody to be in the room to help them. If you have a child, same thing. They're not necessarily going to stay in the right position. So there may be instances where you actually have to be in the room. So lead shielding is really important to make sure you protect yourself. Now, what about for the patient? So sometimes they'll put an apron on them as well. If nothing else, what is the minimum that they weren't going to want to protect? So they have like, it looks like a little skirt almost that they'll put and just sort of drape on you. And it almost always covers your pelvis, because what in your pelvis are you concerned about? Reproductive cells, okay? Because that's where eggs and sperm are stored. And so ionizing radiation that damages eggs and sperm can mean that offspring would be born and affected. Okay, so that's the reason why patients also get a lead shield as well. That's the primary sort of like, we want to make sure that that's not going to be affected. So both patient as well as healthcare provider, having shielding with X-rays is really important. This, if you are doing these routinely, then you will commonly get a film badge. So a film badge just clips onto your clothes, your work clothes, and you keep it for a period of time. They send it in. It actually gets like checked. They look at how much was this film badge exposed to ionizing radiation. So it is a way of being able to monitor how much energy you've been exposed to. There are limits. So OSHA, the Office of Safety and Health Administration, that they actually go through and say, this is how much energy you can be exposed to safely in your job. So if your film badge comes up and it's over that level, then they have to move you out of that area, put you in some other job for a period of time to try and lower your annual exposure. So if you're above, then the next time you're not the person that's helping the kid that needs the X-ray. It's going to have to be somebody else because your levels are above what that minimum standard is. Okay?
What is that black thing that they put? Is that how they see the X-ray itself?
The black thing. Is it like the plate?
Yeah.
Like, so that's actually the film cassette.
Oh, okay.
And so the film always goes under, like underneath what they're trying to X-ray. So the X-ray machine is here, and then your appendage or whatever part they're X-ray, and then there's a plate that they put down. So that is actually the film.
Okay.
And so that film now is pretty amazing because that film's all digital. And so it's so sensitive now, the amount of energy you're exposed to. And if you just kind of think when the last time you went and had, like, say, dental X-rays, right? When they, like, stick the little bite wings and they're like, you know, get the little thing and they're like, okay. And the dental hygienist walks back and you hear what? You hear like a, it's like that long. Like that is all the exposure that you need to have to get very clear results. It used to be like, you're like, not anymore. And it's because of film. So technology has really changed. So even X-ray techs now, the amount of energy they're exposed to compared to even 15 years ago is a whole lot less. But they still make sure if they have to be in the room, then they're going to wear lead shielding to protect themselves. And they're going to have a film badge on to make sure that it's monitored just how much they're exposed to over that month's time. Okay, so I will just show you this because I just found this to be absolutely amazing. So when X-rays were first developed, so this happened really like in the 1920s is when the first X-rays were done. When X-rays were first developed, they were kind of like a novelty. So people would go to a fair and have their hand X-rayed just because it was neat. Okay, see your hand, you can actually see your bones. And so you could go get your hand X-rayed. So it's like this, it's like a carnival thing. In fact, shoe companies jumped on this bandwagon, and in the 1940s, they had X-ray machines in shoe stores. So you could put on a pair of shoes and stand on this box, and the box itself was an X-ray machine. So how great was that?
You could see the perfect fit.
Yes, and think about like the film compared to how it is now. Think about how much ionizing energy that they were exposed to. So this was right when all this technology was really kind of just coming in. But it was like, so you put your shoe on and you'd step up here and it would like take an X-ray of your feet. And then they could be like, oh, look, here's your shoes and here's your bones of your feet. And so your shoes fit. There you go. Okay. But they even said that so they had these boxes were actually lead lined. So they were like, they did recognize that there was this energy. You didn't want everybody exposed. But a lot of times it made the boxes really heavy. And so they were notorious. People would pull the lead out of them so that they were easier to move around, which then meant whenever you turned it on, like everybody was being exposed to ionizing energy. And so in the late 50s, again, this was all when the nuclear regulatory commissions were not really, they weren't really with it yet, but somebody finally said, this is not safe. This is not actually safe, and this is not something we need to do. So these are sort of phased out. But, you know, when things are brand new and people don't really understand that technology, it's all sort of like exciting. I just think it's hysterical. The little kids standing up there. This is great. Okay. So this is like for real. This is like an advertisement that from the newspaper in the 1940s to get your feet X-rayed. Okay. If you're exposed to large amounts of ionizing radiation, then you can end up with what they call radiation sickness. So radiation sickness is really just this overexposure. In fact, when you undergo radiation treatment for abnormal cells as part of cancer treatment, it really induces this radiation sickness. Why? Why would you want to undergo radiation treatment for cancer? Because it kills cells, right? So the focus, and in fact, ionizing radiation has a greater effect on rapidly growing cells compared to cells that are like quiet. Cells that are just those normal slow growing cells are not affected by ionizing radiation as fast as rapidly growing cells, which is a characteristic of cancer cells, right? So we want to destroy rapidly growing cells.
Can it have reverse effects?
I don't understand reverse effects.
Like, if it's supposed to destroy the rapid growth of cells, like, could it, like, do the opposite? Like, could it make them grow more, or, like...
That is a potential. So it is the whole idea, like if you're exposing this person to ionizing radiation, could you cause damage to other healthy cells and cause them to be abnormal? Yes. Okay. But there's the weighing the risks versus benefits.
Yeah.
Okay. So it's like there is always a risk. Being exposed to ionizing radiation puts you at a risk of developing abnormal cells because of what radiation can do. That energy can cause damage to cells and affect that cell growth. So the goal is to destroy rapidly growing cells. But there are naturally rapidly growing cells that are on your body that are, or a part of your body that are not cancerous. So can you think of any cells in your body that grow quickly, that are constantly like regenerating? Skin cells. So side effects. So patients that undergo radiation, areas that are exposed to radiation, you commonly develop like a sore. You can get a rash. It looks almost like you have a sunburn on that area. So you can end up with skin effects. So it can look like a burn or a rash. Some skin breakdown in the area where you maybe have treatment. What other parts of your body grow quickly? Yep. So hair, right? So the hair roots, your hair grows almost a ½ inch a month. Okay. So that's like, you know, those little microscopic cells are just churning them out all in the hair roots. And so those cells get damaged and what happens? Yep. And so you have hair loss. So the root ends up being affected and you have hair loss. What else? You think of another, you know, it's almost like a lot of lining stuff, another area where cells grow fast. Okay, so we can say blood cells. So your red blood cells, they are replaced about every 120 days, so about every 4 months, but they're in constant production in bone marrow. So undergoing radiation can suppress red blood cell production, and so that puts you at risk of ending up being what? So if red blood cell numbers go down, then you end up with anemia. What if your white blood cell numbers go down? That's called what? They would describe you as being what? Immunocompromised. So not a lot of white blood cells means that if you get an infection, it's going to be difficult to fight it off. So they say then that you are immunocompromised.
Is it just with some like cancer patients that affects their digestive system?
Very much. So your GI tract, like the lining of your small intestine, is replaced every 3 to 5 days. So those are very rapidly growing cells. It's because all of those chemicals and foods pass by and rub up against that lining. So it's constantly like shedding and replacing every 3 to 5 days. So a very common side effect after radiation is that a person feels nauseous. They may have diarrhea, and that's all because of disruption in the GI tract. They may also have malabsorption of nutrients. So they may have difficulty digesting nutrients and actually absorbing them effectively. So they end up with like weight loss. They have a hard time eating, but they're also having a hard time actually getting nutrients out of the food that they are eating because of GI tract issues. So the lining can be affected, and that creates the nausea, vomiting, diarrhea, all of those characteristics. But also can cause what they call malabsorption. So mal means bad. right? So malabsorption is like bad absorption, not absorbing the nutrients that you really need from the food that you're eating. So it is not uncommon for them to lose weight. So again, it's that whole idea of you're weighing the benefits versus the risks. So yes, there's all of these negative side effects, but the goal is if we can do this short-term exposure to ionizing radiation and focus it on the areas where we know these abnormal cells are, we can destroy these cells. And the skin, hair, blood, and GI tract, it recovers. So once you stop with radiation treatment, you will begin to see that these organs, the cells that are growing rapidly, they'll begin to return to normal. So this is typically, these side effects last while you're having treatment. They don't like progress and continue years after treatment. Things typically go back to normal. So this is terrible, but I still think it's funny. So this is Marie Curie, okay? And I don't know if that's Becquerel or her husband, but I do know that that is Marie Curie. She was the one that actually extracted and isolated radium, which is number 88. So radium got its name because it actually glows in the dark. Okay, so she isolated, extracted this little sample of radium. She had it in a container, like a little cylinder of glass, and it glowed, so she used it as a nightlight. Okay, she died of lymphoma, which is cancer of the white blood cells. Okay, because of that exposure. So this was back when they didn't understand what this ionizing energy had the capability of doing. So that was like right around the right at the turn of the century, so 1900.
And the radium girls. The radium girls. Factory girls making the watch.
Yeah, so yes. And so that at one time they used to actually paint radium on watch dials so that they would glow in the dark. And so they paid people to have paint that had radium added to it. And so the only way to paint those, the watch hands, was you had to have a very pointy brush. So they would actually dip and lick the tip of the paintbrush to get it really, really straight, and then be able to paint and put the little dots where the times were. So they all developed like mouth cancer, jaw cancers, gum cancer, and everything, because they were like literally like ingesting small amounts of this unstable compound. Yeah, that was another one that but the whole thing, you're looking more radiant every day. Terrible, okay? All right. So here's an application. Here's an application of, one, the benefit to the use of this radioactive substances, but then two, the challenges that come into play. So I know most of you weren't born yet, but in 1986, and this was in Russia, they had a nuclear power plant that was in Chernobyl. So this nuclear power plant was built in the 60s. That was a time when they were saying like nuclear energy is like the future. We are going to stop using fossil fuels, burning oil. We are going to really move to nuclear energy. The problem is in the 80s, there was a lot of inflation. It was sort of like a recession time. So governments were strapped for cash. And so keeping up these nuclear power plants was not necessarily like highest on the list. So here's how it works. This is how a nuclear power plant works. So you have some type of radioactive substance, and typically they're like rods of purified uranium. So they have these, they are in like a little shielded jacket. So these rods, so they kind of look just like these big like columns, but they're in these little shielding jackets. So the shielding jackets are lead lined. That helps to keep them from releasing their energy to anything else. They are set down in this pool of water. So this pool of water, when you release the jacket, so you kind of like pull the little uranium rod, gets pulled out automatically, and it begins to release its energy. That energy heats the water. That water is then converted to steam, and that can run a steam generator. So you know like what happens when water boils, it creates the gas of steam, steam expands, and so that runs a generator. So that's how you can have a nuclear power plant generates energy. If you need a lot of energy, then that means you've got to pull those rods out further so that they release more energy. But like if it's cool, if the energy demands are low, you just slide those little uranium rods back into their little jacket, and that lowers the amount of energy that's being released to this water. So you can kind of like fine tune. You can have supply and demand. So if you need a lot of energy, you're going to have those uranium rods exposed. If you don't, then you just have them sort of in their little insulated jackets. So here's what this is like. Uranium undergoes alpha decay. When it does, remember, it drops, the mass drops by 4. The atomic number drops by 2. It converts to thorium and it releases gamma energy. So that energy starts to heat this water. But the thorium's not done. So the thorium actually undergoes 2 rounds of beta decay. And in each one, remember that neutron converts to a proton. So notice that thorium becomes Pa, which is Pascalium, and then it becomes uranium again. That's a little smaller. Notice at the beginning it's 238, and down there it's 234. So it does, the uranium kind of like regenerates itself, but it's a little bit smaller each time, a little fewer neutrons inside each time. But all the while, you're getting this energy. That energy is what heats the water and runs your steam generators. So everything's great. As long as if you need more energy, you expose more of the uranium rods, make more heat, create more energy through those steam generators. So what happened in Chernobyl is the reactor core temperature, they didn't maintain it. So they pulled the little uranium rods out and they shut off the circulator for the water. So that water got hotter and hotter and hotter because they were running like safety tests. But they didn't have this, the sensors weren't working when they ran the safety tests, which is like really like kind of like seems like you would have tested the sensors before you would have done the safety tests. But they're like, no, it's fine. Okay. And so what happened is the water got so hot in that pool that it boiled. And when it boiled, it was in this enclosed room or chamber. So what happens to liquid when it becomes gas? It has to expand. And when it expands, it generated pressure. It actually generated so much pressure that it blew the top of the reactor chamber off. So it was like this huge explosion occurred that was like seen for miles around. That shot all of this vapor, this water vapor from the pool, shot it all up into the atmosphere. The amount of energy that was generated when this happened caused the uranium rods to undergo what's known as fission. Fission is when an atom splits into 2. So it actually went from being this huge uranium atom to being 2. One is cesium and the other one is iodine. Cesium, when it gets into the atmosphere, if it's ingested, cesium, if you look where it is 55. It's in the same column that sodium and potassium are in. So when ingested, it sits into places where sodium and potassium would, like in your body when it gets ingested. Iodine 131 is a radioactive, unstable form of iodine. If this gets ingested, where does it go? Where's the one gland iodine goes? Into the thyroid, okay? And so these two were actually in the steam that was released from this reactor when the lid blew off. So the water itself had these molecules in it. So the water boiled and you have all these steam water vapor molecules that generated so much pressure, the lid blew off, but these are now in that steam. So all of that now starts kind of like floating away, and they actually started measuring changes in radiation levels all the way in France. They were like, something happened. Why? Because they were like, all of our radiation levels have like tripled. Like, and they were that far away. So you're talking like 800 miles away. They immediately started registering elevated levels of, and then you got wind. So what does wind do? So wind starts blowing it. Okay, so it just starts traveling. So it didn't actually travel towards Europe. It actually traveled further into Russia. In order to fix this, they ended up, like this was a big, long job. They ended up having to actually put concrete over the entire reactor core, over that entire chamber, just dumping concrete to try and seal it. They don't think it's sealed, but it's covered over. And Russia was like, fine, it's done. It's not a problem. Because at first they were like, nothing happened. And so they were like, something happened. No, nothing happened. It's fine. And so then finally, like, they were like, okay, something happened. And then they were like, well, what exactly happened? Well, it wasn't a big problem. And so it was like this back and forth, like literally it was weeks. Cause I remember this. I was like just about to graduate from high school. I was like, what? Jeez. I was like, is this like going to end up being something global? Are we all going to start having like, massive increases in cancer and everything globally because of this? So yes, very challenging. So before 1986, the odds of you getting thyroid cancer in this area was like 1 in a million. So it's really pretty rare, not a common cancer. So in 2003, it's like 60. So they had a 60-fold increase. And so remember, this happened in 1986, in 2003. So that tells you what? That it's still residuals that you're seeing. So young people that were exposed in 86, sometimes cancer doesn't like show up the next day. Sometimes it takes 2 or 3 decades for it to actually end up having visible symptoms that you end up going to the doctor and being diagnosed with. But in 2003, they're seeing like a 60-fold increase in thyroid cancer in that area. So what they ended up having to do, the government was like, everybody get your stuff, we're leaving. So people that worked at the reactor, there was schools, there was homes, apartments, stores, like it had its own little town because this reactor employed thousands of people. And so all their families all lived in the area right around Chernobyl. So they like literally bussed 350,000 people out of that area.
Wasn't this a movie?
Yeah, so it is definitely a worthwhile watch. I think it's very well done. I don't think that they like over glamorize the whole thing. Like it's very well done based on the documents that they have gotten since. But even now, that area is still sparsely populated. So there's still like an area sort of like a no man's land around there. And this is from 1986 because when you look at half-lives of things, look at the half-life of uranium. Uranium-238, how long is it going to take for it to break down? 4.5 billion years. Okay, so it is not something that's like gone tomorrow. So this term half-life is the common term that they use when describing the energy that's released and how long it takes for it to start breaking down. So by definition, a half-life, this is the time for half of a sample's energy to decrease by 50%. To decrease by half. So if you start off with 100, how long does it take for you to have 50? Okay, so if it's releasing 100 milligrams of energy, it'll take this amount of time for you to have half as much. And then if that time goes by, then it'll be half again. So you'd have 25%. So you go like 50 to 25, then 12 and a half. So it would just keep decreasing by 50% every half-life. Natural radio isotopes like carbon-14, radium-226, uranium-238, these are found in very, very, very low concentrations in the earth naturally, but they take a long time to break down. But you don't have them like the whole thing with Chernobyl is they like purified uranium and had it stuck in and made it into these pipes, these columns of metal. So normally in the earth, it is so diffuse and distributed that being in the around and outside and stuff, that you're not going to be exposed to very much because it's such a very, very small trace amount. So it requires a lot to like purify it to actually like, they call it enriching to try and make more uranium.
Have you heard like with the electric cars, the batteries once like they die, they have to like bury them, and like these landfills because like so much radiation. Do you think that will happen?
And it's not the radiation, it is those metals. So some of those metals, so it's not that it's radiation, it's that those metals specifically can be toxic to humans, can be toxic to living things. Normally they're found really, really deep in the ground and they're found at very, very low levels. And so they're not typically on ground surfaces, they're not typically in water supplies. And so the big concern is like, oh, well, when you have to pull, 10 car batteries out and you just throw them in the trash and they end up in a landfill. And now you have 10 cars of those. Now you got 100 batteries in that landfill that then as they start breaking down, that they end up getting into the groundwater. So it's more of the metals that are used to make the car battery is more what they're concerned about versus radiation, because they're not releasing radiation, but those chemicals, those metals can be toxic.
It's
Yeah.
just a coincidence that they want everybody to go electric for cars.
Well, until they like get their battery things all situated where they have very, very long lives and they like figure out like how to use a little less hazardous types of chemicals and generating them, yeah, it's still a challenge. Most of the ones that you use in medicine, so radioisotopes that are commonly used in medicine, they have very short half-lives. So you don't want something that you're going to use to treat a patient with. You don't want it to be around for years. Instead, look at the half-life. So these are things where they're days. Some of them are even just minutes. Some of them are hours. So if we're looking at like iodine 123, in 13 hours, half of what you would give a patient would be gone. And then another 13 hours, so basically a day later, it would be gone half again. So it'd be all the way down to 25% in a 24-hour, 26-hour time period. So that's a much shorter half-life. And that's really the goal. So we're just not going to do half-lives because I want to make sure that we get through like the talk about what you use it for. So in this, you don't have to worry about this, and I won't put any of these. This is like the math part. So you don't have to worry about those. But the application, okay? Because I want to make sure that we get through this part. So when thinking about half-life, nuclear radiation that's releasing this energy, you can sometimes have it as an external source, okay? So like you can expose from the external, but then you can also put this internally. So you can ingest it or you can inject it. Sometimes you can inhale it. This can be used in a couple of ways. They use radioactive isotopes as diagnostic tools. And a good example is iodine. So remember I said, so there's iodine 123. So 1, 2, 3. So iodine 123, the 53 would be down there. Iodine 123, we said the half-life is only 13 hours, like 13.2 hours. That's its half-life. They give a patient a very low dose, the lowest possible dose of iodine 123. So you drink it, it gets absorbed, and where's that iodine going to go? It always goes only one place, which makes it really easy to use. So it only goes to your thyroid. So then they can scan or measure the amount of energy that's being released from the area of the thyroid. If you have a normal thyroid, then it's going to look kind of like the top. So just as a reminder, so your thyroid is here. So if you feel for your Adam's apple when you swallow, that's little bobs up and down. Just below, into the left and the right, below's your trachea, but just to the left and the right are these two soft glands. Those are the lobes of the thyroid. And they're actually connected by a little bridge, which is why it kind of has that light blue dots kind of connecting them. So your thyroid, it's soft, so it's not hard, so you're not going to feel it. But it's kind of like two little glands with this little isthmus, which is the bridge. If iodine is taken up uniformly, then you'll see this. So that, do you see like the red shows highest energy? The yellow is medium, the blue is the least. And so the lobe is thickest in the center, so that's where it looks like there's glows a little more in the center compared to the edges, but otherwise it looks pretty uniform. So that's the nice one, that the computer can colorize it for you. The typical ones, they just do in black and white. So I found these ones on the internet because I thought those ones were actually pretty good. This shows you how it should look, not colorized, but notice how it just shows kind of like two gray areas. So this would be one lobe, this would be the other lobe, right? And there's their little connection. But you see that they're kind of, it's uniform. It's a little darker in the center, but the thyroid is thicker there. So it should be a little bit brighter or a little more iodine there because there's more cells. Areas where it's thinner, you would have fewer cells. So that's why it's a little less on the edges. But then look, this is a patient that has Graves' disease. So how different does that look? See how dark it is? So see how these are much darker than normal? This shows overactive thyroid activity. So this shows that these cells are way more active than they should be. That is a characteristic of Graves' disease. So Graves' disease, the patient, when they develop this, that you start to see person loses weight, they have problems sleeping, they complain of racing heart, their blood pressure goes up. It is because their thyroid is way overactive. Your thyroid releases thyroid hormone, which controls your metabolism. So basically, if you have Graves' disease, your body cells are like in high gear. So your body cells are like burning energy like mad, which is why like your heart's beating so fast, because it's almost like you're in this like constant state of anxiety and stress sensation. And so long term, that's bad because that can wear your organs out. So hyperthyroidism, the danger of that is you end up developing heart issues. You end up ending up with hypertension. You end up with other organ failure, and you don't live a normal long life. So with Graves' disease, if they see something like this, they know they need to treat it because it's overactive. Look at this one down here. So this is something where they were exposed to something toxic. I'm not sure what MNG is. I don't know if it's manganese. I don't know what it means because I didn't get the key for it too. But in this, what do you notice about that? It should look like the normal, but what would you say? Look at this left side. See how this left side's really dark, but the right side has like this white area and only a little dark area. So definitely shows irregular activity in the thyroid. The last one, a toxic adenoma. So remember that your thyroid is supposed to look like these two little glands. What does the thyroid look like here? It looks like one. And so this is where you have abnormal cells growing in the thyroid. So it's like swollen and like literally they've grown in together as one. It could be one gland that is overgrown, the other gland as well. But irregardless, it does not give you the pattern that shows that there's normal iodine use in those two glands of the thyroid. So for B, C, and D, you're going to want to treat this because otherwise you're going to end up with this chronic hyperthyroidism and having issues. So you treat it therapeutically. So diagnostically means it's going to help figure out what's wrong. So trying to make a diagnosis, you always want to use the smallest dose possible for diagnosis. And you always want to make sure that you pick a radioactive isotope that has a very short half-life. Therapeutic doses are usually higher doses, and they're going to have radioactive isotopes that have a longer half-life. So for these three patients, they would instead use iodine 131. Still number 53, but iodine 131, I got to flip back so that I can tell you how long its half-life is. 131 is 8 days. So see these two? The difference between them? Iodine 123, 13.2 hours. Iodine 131 is 8 days. So they're going to give you a higher dose of this. And then it's going to take 8 days for half of it to disappear out of the thyroid. And then 8 more days for another half of it to disappear. So it's actually going to take about a month. It'll take about a month for it to get to such a low amount present in the thyroid that you don't have to worry about exposing others. So while somebody's undergoing iodine 131 treatment, things that they do, they want them to take precautions because you don't want family members to be exposed to this. And in theory, iodine 131, yes, most of it goes to your thyroid and it's stored there directly and it's not found in other places, but it could be in body secretions. So when you think about body secretions, what do you think about? Sweat, saliva, urine, feces, okay? So they tell people that are undergoing this iodine 131 treatment, one, you need to sleep by yourself, okay? So that you're like not sleeping next to somebody. You need to wash your sheets separate from other members of the family, and you've got to do an extra rinse. Wash your towels, your clothes because of the sweat, okay? Just so that if there is any So when you use the toilet, you're supposed to flush twice just to make sure that you're like rinsing. So if there's any iodine 131 in any of your excretions, then all of that ends up getting diluted and then flushed away so that it decreases exposure to your family members. So they're supposed to like wash their utensils separately to try and decrease because of any saliva. So anything that could potentially, that's all a risk. And that lasts about a month, because if we give you like 100 millicuries of iodine 131, in 8 days, there'll be 50. And then in another 8 days, there'll be 25, because it decreases by half every 8 days. So really after 24 days, you're down to like 12 and a half. So it goes from 150, 25, 12 and a half. Then it gets down to like 6 1/4. So then it's at a really pretty low level by the time you're at after about a month. And then they go back and retest. So you're like, well, we need you to come in so that we can see what your thyroid looks like. So they can give them a very low dose of 123 again, and it really should show no activity. So it should basically just stay sort of quiet. It should look like there's nothing there. So those patients now, they don't have a thyroid. So their thyroid cells get destroyed, good cells and bad cells. All the thyroid cells get destroyed. So they actually have to take artificial medicine, hormone replacement therapy for the rest of their life. It's not painful because there's no surgery.
It just gets rid.
Yeah. I mean, some people describe it as feeling like it's swollen, like there's a little inflammation that occurs, but it's not like burning or anything like that. And all that, so that iodine is releasing energy, and that releasing of energy damages those cells. And those abnormally growing cells are going to be most affected. So that's going to help to destroy those abnormal thyroid cells. And then you just give them thyroid hormone. You have to take thyroid hormone every day.
So when you say the thyroid hormone, is that why they have to take it like when they first wake up?
And sometimes you have to take more, sometimes you have to take less. Like they have to, it's almost like insulin. You have to like figure out what your baseline is, what your dosage needs to be. And then if you get sick, it may change. If you like start working out, it may change. Like there's a lot in terms of like tweaking that thyroid hormone, trying to get it just right. But yeah, but it's better, and you'll have a longer, healthier life that way than dealing with the hyperthyroidism. Because the hyperthyroidism is inevitably going to end up leading to heart disease and heart failure and heart attack, stroke, all those types of things end up happening younger. People that had hyperthyroidism, typically they'd live into their 40s and 50s before stuff like that would end up happening. So somebody that has their thyroid treated, they can live and be 70, 80 like normal.
My grandma has an underactive thyroid, and she takes medicine for that.
Yeah. That's hypothyroidism. So she actually takes thyroid hormone as a supplement because her thyroid doesn't do as much as it needs to.
They thought that she had high cholesterol, and then it wasn't. It was
Yep, because thyroid hormone affects how fast your body cells do chemical reactions. And so if you have a low thyroid, then your body cells just don't respond to things very quickly. And so it may show up being like other odd stuff, like weight gain, tiredness. People are like, are you depressed? No, I just don't have any energy. Well, that's because you don't have any thyroid hormone. If you don't have any thyroid hormone, your body cells are like, we just can't. We're very tired all the time. But then those people that have hyperactive thyroid, those people are like up at 3 o'clock in the morning cleaning the house. And they're like the people that can't sit still, super skinny, and they're just like always busy. And then if people take too much thyroid hormone after treatment, they act the same way. Because I've had some friends that I was like, just how much are you taking? Your house is very clean. All right, so diagnostic, that's sort of the goal. Smallest dose possible, because you want to have the shortest half-life. Whereas therapeutic, you're going to have a longer treatment, higher dose, longer half-life type of radiation, and that may require that you have some precautions. One other interesting way, because they've started to use this in a number of different ways. This was one that they started doing during COVID. So with COVID, a lot of people had a lot of respiratory complications. Not everybody. Some people had no symptoms. Some people just had a cold. Some people had flu-like symptoms. There was all kinds of the gambit of things. But for people that really ended up being in critical care, that was mostly because of respiratory complications. And so here is one way that they can actually look and see how well your lungs are ventilating. So they use a radioactive gas called xenon-133. And so what the patient does is they actually have so Xenon 133, it's in a tank. And so they're like, okay, take this and I want you to just inhale and hold your breath. And so you inhale the Xenon 133, take the deepest breath that you can, and then they do a scan. And that scan actually shows where air flows into the lungs. So it can show them, do they have areas where there's blockages in terms of airflow? So like with an asthmatic, this would not look very dark. It would be very, very light because of airflow in blockage. Or if there's a tumor, you could see an area where there's no flow in because the xenon gas is not going to get there. But the nice thing with this is you take the pipe out of your mouth and you exhale and it all comes back out. So it ends up being only affecting you as long as you're inhaling it. It's just used for this diagnostic purpose. The second one, though, is using technetium 99. This gets injected. What this does is it actually goes into the bloodstream and it flows through the capillaries that wrap around your lungs. So it can actually show areas where you're not getting good blood flow. So if you get a lot of scar tissue development in the lungs, then you'll lose the capillary beds that supply that part of the lung tissue. So you see those parts they call cold spots. See where there's sort of light areas, right in here? That kind of light area, that shows that there's not good blood flow in that area. That could be an area where you've got pneumonia or where you have scar tissue. So a lot of people that had COVID ended up with what they call this long-term lung damage. So that scar tissue ends up affecting blood flow into that area and gas exchange. So those are just now parts of the lungs where you're not getting good gas exchange. That's why these people have problems beyond just having COVID, where they have this scar tissue. So they just don't have the oxygen carbon dioxide exchange that they used to have. So it's really kind of interesting. Cancer treatment can be external. So external beam means that so an example for this, if they find a melanoma. So melanoma is typically described as being what? Skin cancer, okay? So it's a mole that has begun to grow abnormally. So they typically go through, they remove it. Surgical removal is typically the first step, but they can use external beam to be able to treat the area. So they'll treat the area where the mole was and then surrounding skin areas just in case there's been any spread. There is even what they call brachytherapy, where they actually implant seeds that contain a radioisotope directly into a tumor. So this is a common way that they treat prostate cancer. So these seeds, and when you look at the size, these look like little tiny pencil leads. That's how small they are. So there's the size of a penny, just so that you have as a comparison. So they're not big. They're really tiny little thin pencil lead looking pieces, but they coat those pieces with a radioactive substance. Typically, it's one that emits alpha decay, because remember, alpha decay doesn't go very far. So if you implant this seed, it's only going to end up affecting the cells right around it. It's not going to go very far. And so this can be very helpful if you know there's a defined tumor. So you don't have to go in and surgically remove it. You implant a number of these seeds, and that will cause those cells to die and just convert to scar tissue. So it's like an option instead of having to do surgery, being able to treat it this way.
Do they take them out?
Yep. So they can, because again, it's a half-life thing. So it depends on the length of time that that radioactive isotope is emitting energy. Sometimes they take them out just because, I've had friends that ended up having treatment this way and they were irritating. So they ended up going back and removing them. So it really depends on the patient, because I've heard of patients that didn't have them removed because once they get to such a low level, they're not really releasing any kind of energy anymore. Okay. All right, so last one, then we're going to quit. So the last one is, here is an application that is used pretty frequently. It's called positron emission tomography. So positron decay, we didn't actually talk about this one, but it is very similar to how your gamma rays work. So they call it a positron emission tomography, or a PET scan. So PET scans use fluorine-18 is the common one. So they take a glucose molecule. So you remember glucose is your blood sugar. Okay, so normally you have this blood sugar that circulates through the body. And so they attach a radioactive isotope, fluorine-18, to a glucose molecule. But it only has a half-life of 110 minutes, so like 2 hours. So when you give them this, 2 hours, half of it will be broken down, another 2 hours, another 2 hours. So it doesn't last in the body for very long. But that glucose automatically ends up being taken up by brain cells. So your brain cells don't have to have insulin to be able to take up glucose. And so they give this to you. Yes, other body cells end up taking this, but the brain seems to be like it's the quickest place that it's going to show up. So this fluorine will show up in the brain, and they can actually have them do cognitive things and measure what parts of the brain is glucose being utilized based on using this fluorine-18. So for example, they'll have the patient read something, and you'll see that part of the brain will light up, the part that's associated with words, with languages, and comprehension. Or you can ask them to like talk, and you'll see that speech areas will light up. So it's really interesting to be able to identify if there's certain regions of the brains that are damaged, that have been injured, that are not working appropriately. So this is one that's interesting. Instead of just showing you what it looks like, it actually tells you how things are working, because glucose is used to make energy. So when these brain cells take up the glucose and utilize it, then that's going to be shown as being an activity. So here's an example. So the one on the left shows normal. So this is a normal PET scan, normal brain scan. The more red it is, the more active. The more yellow is the medium, blue is low, black is no activity, okay? Just so they like colorize it. So the more active it is, the more red, kind of reddish orange it looks. Medium activity is those yellow areas. Blue is low, they call them like cold areas, and then black shows no activity. Over on the right, though, is a patient that is suffering from Alzheimer's. So notice the changes that have occurred. Looking at the same area of the brain, doing a PET scan, you can see seriously diminished activity. Notice there's a lot less of that red, a lot more of the blue, and then even those blackened areas. So those are areas where you have scar tissue forming. So neurons have actually died. So they're not utilizing glucose. They're not active. And so they can kind of like monitor this progress. It has allowed them to like do a lot of clinical trials, being able to use different kind of medications. So there are some Alzheimer's meds out there that help to slow the progression of Alzheimer's. But this scan helps them to kind of look at, well, what's happening in the brain? What actually is going on? And having this really short half-life of just 2 hours means that it's not going to be something that you have to deal with for hours and hours. Within 6 to 8 hours, it's literally gone. So it's not going to have any detrimental effect to those brain neurons. So just sort of another interesting application of PET scan. Just helps you to show activity compared to just structure. Okay, so I'm going to quit there. I do want to make sure that everybody is all on base with me with no. Okay. No. I want a blank slide. Give me a blank slide. Okay. So for the exam, you've got the exam is on for you guys. It is Tuesday. So exam 1 is Tuesday. Now, things to remember. 1, do note that it's over everything we have talked about. So like today, I didn't talk about half-lives. Half-lives are not on the exam. Okay? I didn't talk about like specific heat in chapter 1. It's not on the exam. Anything I didn't talk about in class, it's not on the exam. But I did talk about a lot of stuff, okay? So anything that I talked about, all the examples, the practice and stuff that we did, all of those are fair game. So just know that as you're going through, if you're looking through your e-text, if you're doing homework problems and stuff, just know that those aren't. You know that you will get this, okay? You also know that I have 12 calculators, okay? And there are 35 of you. So if you have a calculator, bring it. Okay, just so that you're not waiting. If you don't have a calculator, then you may end up like waiting for somebody to finish. It's again, that first come, first serve kind of thing. So if you have a calculator, then I encourage you to practice with your calculator at home as you're going over this math, and then make sure you bring your calculator because you're a little more familiar with it. Okay, last thing, if you didn't pick one up, remember that you can make a note card. So this is a 4-inch by 6-inch note card. So if something happens and you lose your note card, you can cut out a 4-inch by 6-inch piece of paper and use it as your note card. I don't mind, like a blank piece of paper. You can do it that way. You are allowed to write whatever you want on one side. So one of the criteria is when you come to take your exam, you've got to flip your note card over and show me that you only wrote on one side. If you write on both sides, because I've had students do this, if you write it, it's just not fair for everybody. Okay, it's either everybody gets 2 sides or no one gets 2 sides. So no one gets 2 sides on this one. Okay, maybe on the next one. All right, so you've got, if you have writing on both sides, then it's mine, and you don't even get to use it for the exam. Okay, so just know, just gonna say. So don't be sneaky. Okay, just do it. Last thing is, we're kind of cramped in here, so I've reserved 7104 for you to be able to take your exam. 7104 is the auditorium right when you come in the main entrance. I will put a note on this door to remind you. So when you walk here and no one's in here and the door's locked, there's a sign on the door that says, go to 7104. That's the one that's kind of where the fish tank is. If you ever come in the very big front of the building, it's the double doors on the left. It's like our auditorium. I will be in there starting at 9 a.m. So if you want some extra time on Tuesday, if you're like, I don't really want to be stressed thinking like, oh, I've only got an hour and a half to do this. If you want to show up at 9, completely fine with me. I will be there and I will have the exams ready for you to start then. Okay? Any questions?
I have a question. It was, so the symbols on the periodic table, you said it was 12 or 30?
30. There's the 1 through 20. And what you want to do is look at the PowerPoint for chapter 1, find the periodic table PowerPoint slide, because that one has the extra 10, right? So it's all elements 1 through 20. So from hydrogen to calcium, you should know the names and symbols. And then I gave you 10 more. And the 10 I gave you are ones that we're going to talk about pretty consistently over the entire semester. But there was just 10 more.
So there's like 30 elements, we just need to know the name of the symbol.
Yes, names and symbols, right? Because you have the periodic table. You do not have to memorize atomic numbers. You do not have to memorize atomic mass. You do not have to memorize any of the information on the periodic table because you always have it, okay? So you don't need to worry about trying to put any of this stuff on your note card. But you may need to put, like, say you just have a really hard time remembering silver from gold. So maybe you need to write their names and symbols down on your note card, okay? I have had students, I told you, write so small, that it's like amazingly small. Like write so small. And I was like, what in the world? But like, yep. So I would make a list. I would like start and make on notebook paper. I would like make a list of things that I think I need to put this on the note paper. I think I'm going to need to write this example on the notebook, on my note card. I'm going to get all of that done and then figure out, okay, what do I really need on here? And then put it on. And make sure you put it in an arrangement so you can find stuff. Because I have literally seen students going like, I don't see it. Like they just randomly wrote so much stuff that it wasn't so meaningful. So that's why I say kind of make like a page first and then work your way down to like what you really think you want to put on there. Okay, so I'll be there at 9 a.m. Make sure that you complete mastering. So you have chapter 2. We're done chapter 2. So chapter 2, post-lecture homework. There's also a radiation, radioactive elements, radioactive decay, dynamic study module. So it goes over stuff like alpha, beta, gamma decay, and like identification. So that'll help as well. So do make sure that you get those done. So there's mastering assignments as well. I can't think if there's anything else. And it's in 7104. Okay?